Acupuncture. Introduced to man thousands of years ago in the Eastern Hemisphere, a form of medicine predicated on internal balance to restore homeostasis within the human organism. In early times, nature introduced to man the understanding of yin and yang. From this unification of yin and yang came the sounds of the first human heartbeat. As the heart continued to beat, man became more aware of the importance of aligning themselves with nature. Whenever disequilibrium overcame the human organism, man would turn to acupuncture to restore balance. Fast forward to present. East meets West, and forth comes the advent of integrative acupuncture. Uniting the forces of Western medicine with Eastern medicine, here I stand. Just as it shall become yours, acupuncture has become my life. Let us begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott, your host and educator from Acupuncture's My Life. Now today's discussion, we're going to talk about a powerful combination, and that combination is acupuncture and physical therapy. Now I'd like to welcome my guest onto the show, Andrea McFarlane. Hi, how are you?
Hi, Leora. It's so nice to be here. Thank you.
That's good to know.
For inviting me.
She's a licensed physical therapist, and today we're going to talk about physical therapy and a little bit about acupuncture and how it all works together. But now, I want to start by asking you, Andrea, please tell my audience, what is physical therapy?
Physical therapy is a very wide scenario. There's so many areas that you can specialize in, but really what it is basically it's a treatment of disease and deformities, any physical ailment that you have that we're able to treat. You can use physical methods, heat, electrical stimulation, ultrasound, massage, but most importantly, we also prevent injuries. We deal with sports medicine. We also deal with name the condition, we can rehabilitate you. We are really big on rehabilitation. So if you start off with, let's go for example, you have a stroke.
Right.
Usually with a stroke, it involves one particular side of the body.
Right.
The blood is cut off from the brain and it becomes paralyzed. Now, as a physical therapist, this person, whatever the age, you could be young, you could be middle-aged, you could be old to have a stroke. We are going to teach that person how to get back all their functions that they had before.
Right.
I mean, you can start as simple as, how do I get out of bed?
Okay.
If they're non-ambulatory, that means they're not able to walk yet.
Mm-hmm.
How did they get in their wheelchair? We teach those techniques.
Wow.
I'm telling you, it's really starting from scratch.
Right.
Now, with a stroke, you may have someone that has no movement,
Mm-hmm. Mm-hmm.
some movement,
Right.
or what we call synergistic movement, that it doesn't really move like normal.
Right.
It'll be like in a pattern because the brain is very complex and it really, depending on the area of the brain that's affected. Physical therapy also works with a knee replacement.
Right.
You can do a hip replacement. Paralysis is something like a gunshot wound. You can affect the spine.
Okay.
We have to teach those patients how to get back, whatever
Normal
movement,
function.
depending on what level the injury. We're also great in sports medicine.
Okay.
Sports medicine, the Super Bowl's coming up. Anybody that gets injury, they go now to a physical therapist because they don't have a whole lot of time to get back on the field. So as long as there's not a broken bone or a broken joint, that physical therapist is going to use all the different modalities. But don't let me forget, it's a lot of exercise.
Oh, definitely. And it's
A
interesting.
lot of exercise.
It's interesting that you spoke of stroke patients, because also with acupuncture, I'm very good with that.
Okay.
And working together with a physical therapist such as yourself, I do a lot of scalp acupuncture. Okay, because it's contralateral.
Yes.
Okay, this side of the brain
That's
shuts
right.
down, it affects the opposite side
There
of the
you
body.
go. That's right.
So we have the motor sensory lines that I
Yes.
focus on, as
Wow.
well as I do points on all extremities
Yes.
to reinvigorate chi and blood. But I have another question for you. How does physical therapy benefit patients?
Well, the reason that it'll benefit all patients is because we're actually rebuilding your function. So depending on where you are in your level of injury, we're going to re-educate your muscles.
Right.
We're going to be teaching you what we call functional activities, getting out of bed, going to the toilet, getting in the shower. And these are all techniques, because say the person does not have full active motion of all their joints. We're going to be showing them the technique that'll help them with assistance to the level of where maybe just supervision.
Okay.
So we're dealing with function, strength, coordination, agility. The big thing is walking.
That's important.
Walking is a big one. And now if you have an injury, I'm going to tell you what I find. With an injury, we have a tendency to compensate for our injuries. So if my knee hurts, I am going to focus on my knee pain, and I'm going to walk like my knee hurts. Now, the importance of a therapist is we watch how they walk. We call that gait training. Normally, people don't think about how they walk. They just walk.
They just walk.
But when there's an injury, they're compensating. So as a therapist, man, I always tell my friends I could spot a limp 10 blocks away, because I can tell there is some compensation going on and there's some discomfort.
That's a great talent to have.
And I'm telling you, they have no clue that that's what they're doing, because they don't really see themselves.
Wow.
So my question would be, why you limping?
Okay. Which makes sense. And it works out great with acupuncture. I
Yes.
mean, I see the connection, because acupuncture is about restoring homeostasis, reinvigorating chi and blood, and just through the theory of yin and yang, just balancing the body out.
Right.
And to work together with a physical therapist and restoring natural function, I mean, it's a marriage. It's a marriage made in heaven. But I have to ask you another question. Under what circumstances would someone require physical therapy?
I'll be honest with you, you can require physical therapy even just as a preventative measure.
That's interesting.
We do prevention. Like, one of my specialties is body mechanics. I can teach a healthcare professional or a home health aide or a nurse, when they're dealing with a patient, how do you move your body so you don't get injured?
Right.
How do they help the patient so that the patient is safe and yet complete the function? I work with children. You have children that are born early birth. That means they're 4 weeks early, 6 weeks early. They might not be the full 4 or 5 pound, which is expected. So these children tend to develop slower.
Okay.
Number one, you're dealing with parents that are very protective, very afraid because of the medical issues that came up. When I go in a home for a child, I am trying to get that child back to normalcy. On the floor, getting them back rolling, moving, all of the things that children are allowed to do, but when they're delayed in their development, the parents don't necessarily allow them because of fear.
Fear. So you cover the entire spectrum.
Oh man.
Birth, Well, I wouldn't
tell
say
you.
birth, but all the way through.
Well, I call it 0 because if you're born early, if you're supposed to come out in 32 to 34 weeks, and you're born at 24 weeks, so we call it 0, and we call it corrected age. So when they were supposed to be born, they're technically functioning a month later or 2 months later. So you're really saying 0 because your quote weren't supposed to be here yet. You were prematurely born.
Right.
But my experience is very wide. My oldest client was 108. Her daughter was 80 and didn't look as good.
Wow.
But that's just based on my experience because I've covered a lot of different areas of physical therapy.
Right.
Because you can specialize with children. You could be a pediatric therapist.
But you do all. You do it all, from pediatrics to geriatrics.
I've been blessed to love working with children and adults, and they're very similar.
Well, let me ask you this. What's the response? I mean, how does, let's say, someone that's 0, as you put it, how do they respond to physical therapy? I mean, is it quicker? Is it the normal rate that, let's say, an average person, 20, 25 would respond?
All right. Say I go in and it's a 3-month-old baby that was born 3 months ago. So corrected age, they might be really only 2 months.
Right.
Now, you have to know the normal development of children. The reflexes, do they hold their head up? Do they need support when they're sitting? And, you have to know all that. So if I go in there with a 3-month-old, I'm looking for, can they hold their head? When the parent holds them, are they supporting
And this
themselves?
is at 3 months?
Yes. Because you know what, the reflexes are already there and you're checking for the reflexes. But your most thing is the child following you, because the vision is not as good, and you're teaching them tracking. You use colors, you use sound, so it's verbal, tactile, and auditory stimulation. But the most important thing with children is the parents are being taught.
That's
The
interesting.
parents are being taught, because you can't have the mother holding the baby all day and expect them to strive. What they tend to do is they tend to hold them out of protection. And I would go in a home, I'll give you, for example, I had a client where I saw the child for the first time. She was a 2-pounder, so she was already delayed, and she might have been about 4 months old when I first saw her.
What are some of the things that delay these children?
Well, if the child is born early, it might be that the parent had diabetes, or they had medical issues themselves, and the baby had to be cesarean, or multiple births are very popular. With multiple births, maybe the mom is not able to carry the children full term because of whatever issues with having 2 kids, the drain on the body and things like that. So I get a lot of multiple births, and I might find one of the child might be as should be, and one child might be delayed. I've had even triplets.
That's interesting.
I've had triplets where one child didn't need physical therapy because they were functioning normally, and then the other 2 I had to work with. But the most important thing is teaching the parent. The parents are really afraid.
Well, they sort of become the patient.
Yeah, well, technically, I guess it's you have to look at it from both ways, because you're working with a child, but the parent has to watch you, and then they practice when you're not there. Because therapy is usually 2 to 3 times a week when you're in the home. Because my specialty is home care, and when you go in the home, it's not for everyone, because you never know what you're walking into, and you really are treating the whole family. So with children, it's really, really interesting. I'm really teaching the parent, but I'm also showing them.
Well, let me ask you this. Outside of teaching the parent, dealing with someone, let's say, as you would put it, 0 years of age, and then someone, say, 70 years of age.
Yeah.
What's the difference?
Big difference. First of all, when you're dealing with a baby, you're dealing with the developmental activities. The rolling, the head control. Do they pull to stand? Do they cruise on the furniture and things like that? So you're dealing with developmental activities because you want them to be as normal as they can to what a kid that never had an issue would be. A 70-year-old, depending on the diagnosis, if they have pain, some of them is arthritis. Somebody may have a knee replacement. In terms of receptive to the physical therapy, it depends on you, the practitioner. You have to interact in such a way that it doesn't look like work. The children, you got to play with them. You've got to make it fun. You've got to have toys. I have the parents get the necessary toys because, you know, when you go from house to house, you don't want one kid's toy with another kid because they slobber all, you know, just from that. And you want to stimulate them. So you get them the toys, the colors to make them want to move. And I would facilitate the activity without me, you know, having to move them. I use the toys. And now a 70-year-old, you're going to make the activity fun, but it's functional. So a lot of times you're dealing with pain. So I use a special technique that I kind of should market it, but it's not strange to everybody. It's energy conservation. When we're in pain, guess where we focus on our pain? A 70-year-old with a total knee replacement, they're going to be holding the leg like a hostage. And if you go near them, they're going to jump. It's all out of fear of what's going to happen. So I use a simple technique as counting out loud in a rhythmic way.
So is this part of the energy conservation technique?
Yes. Wow. Yes, because they waste energy when they tense up and they're afraid.
Gotcha.
So they automatically go into tension. So it's very hard when someone is in pain to bypass that pain to get them to move. And the cure is movement. How do you get someone to move when they're thinking if they move, it's going to hurt? So they anticipate.
See, and I see as you speak on that point how acupuncture works great with that, because there's certain points on the body, especially the spleen meridian, that's responsible for muscle activity. Or the liver meridian that controls the tendons. There are releasing points. To get patients to draw down, relax.
There you go.
And alleviate pain. But I want to ask you another question. In your experience, what are some of the more common cases that you tend to encounter a lot?
Well, I get a lot of low back problems.
So do I. Okay.
That is kind of like the most popular. You don't even have to be, quote, ill. We all work. We do different things around the house. And most of us are not conscious that we abuse our backs every day. Now, when it goes out on us, we say, oh, I can't move. But that back is just tired of you abusing it.
And that's where you would focus on the preventive aspect. To avoid that. But then you get cases after the fact, after they've already ruined the back. Wow. So now how do you deal with people that have back problems?
All right, back problems, you're going to go back to the basics, because their problem is they're not moving well. They're compensating. They're holding everything stiff. So I first start them with how to get out of bed.
Makes sense.
How do you walk? I also use the mirror as feedback, because a person that's in back pain, the whole body is held hostage.
So you have them look at the mirror?
Yes. Oh, wow. I use a little feedback because consciously they don't even know. All they're doing is protecting. And I've had one particular client, I used to work in an outpatient, and I used to always tell her, move a little to the right. She said, but I am straight. I said, you haven't seen yourself in a while. You've compensated for so long that you think this is straight, but it's just you compensating. She went home because I kept doing the verbal cues. And in her mind, she said, I thought I was straight. She said, Andrea, I had to go home and take all my clothes off and look in the mirror. And I saw how high my pelvis was and how crooked I was. But I never thought of it before until you kept saying that. That's like big.
So you have techniques to sort of like realign the pelvis.
Oh yes. Now, we're not chiropractors. But what we do is we specialize with exercises. So we stretch, we strengthen,
which is important.
We teach coordination, we teach balance, and we teach function. So because we teach function, we got to make sure you function in every area of your life. And something as simple as getting out of bed, somebody tells me they pull their back and they're hurt.
Right.
And I said, what are you doing? Oh, my doctor's giving me medicine. I'm not doing much. And I said, do you make your bed? They said, oh. I said, how do you make your bed? I said, I guarantee you, you're aggravating your back when you make your bed. And you had no idea that you were aggravating your bed. So I have this little handout that I normally give them. It shows them the do's and don'ts of managing their back. It's not an exercise. It's just to show you things that you do every day that may not contribute to your back getting better.
That's great. You know, I could really see how we can work together in a lot of cases, because I deal with a lot of back pain, and for me, the biggest sign is chi and blood stasis. Now, chi is a form of energy that traverses the body, and movement, like you said, is very important. And when chi stagnates, a myriad of problems are created as a result. And it's my job to find out in which meridian the chi as well as the blood is stagnated, and to just really break it up and do what has to be done. But I will say, it was great having you on my show today. And I appreciate you coming out to talk to my audience. And if anyone wants to get in touch with Andrea, you can contact me at Acupuncture is My Life. And I can set things up where you can see Andrea. If you have any questions for her, feel free to give me a call. But I will say, until next time, always remember, acupuncture is my life. What's yours?
Acupuncture is my life.